Refugee and Migrant Technical Assistance Center for Behavioral Health, also called REMTAC, which is made possible by funding through the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Our team is proud and eager to present to you all on implementing a trauma-informed approach to refugee and migrant populations, which includes such populations as technical refugees, asylum seekers, parolees, unaccompanied minors, human trafficking survivors and victims, and forcibly displaced individuals. As we move into the contents of this presentation, please be aware that we may cover heavy topics and material, so we encourage you to be mindful of what comes up for you and engage with the content as you are able to do so.
Thank you, Esther, for the warm welcome. So let's go ahead and move on to the agenda. These are the areas that will be addressed during today's presentation. We will begin by defining trauma and looking at specific examples that affect refugees and migrants before identifying the symptomology of traumatic stress. We will then finalize the presentation with an explanation of the principles of trauma-informed approach. Now I will pass it on to Titus, who will give you an overview of who we are and what we do. Thank you, and we hope you enjoy this webinar.
Hello, everyone. I am going to be going through the website, remtech.org. You can access it by entering remtech.org. This is where we have all of our information, all of our resources, things like that. So I will briefly go through this. Here at the very top, so you will see, so Refugee and Migrant Technical Assistance Center for Behavioral Health is also known as REMTech. It's a training and technical assistance resource center for behavioral health professionals and agencies that serve or plan to serve refugee and migrants across the U.S. The purpose is to grow and support the capacity of behavioral health professionals and organizations that serve refugees and migrants in the U.S. I will play a brief, it's a short video.
Welcome to the Refugee and Migrant Technical Assistance Center for Behavioral Health, also known as REMTAC. REMTAC is funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. REMTAC's purpose is to grow and support the capacity of behavioral health professionals, individuals, and organizations that serve refugees and migrant people across the United States. If you provide services to refugees or migrants, you are in the right place to connect with experts, access a wealth of resources, and get real-world tips to support the incredible work you do for this vulnerable population. And all for free. Learn, grow, and succeed with REMTAC, the Refugee and Migrant Technical Assistance Center for Behavioral Health.
Wonderful. And after I'm done with my portion, I hope everyone remembers that this is free. All right. Okay, so moving on. I will move on to the section that says what we do. So the Refugee and Migrant Technical Assistance Center for Behavioral Health supports behavioral health care providers by offering technical assistance to develop a toolkit of resources to better equip providers as they serve refugee and migrants. A few of the key areas that we focus on is conducting a needs assessment, completing a literature review, creating interactive online learning modules, establishing learning communities. We have a service directory, and of course, we have the consultation and technical assistance services. Below on this page, you will find our newsletters. Moving on to the next section is our knowledge base. And of course, this is free. Okay, so there are many beneficial resources you can access as a provider. With REMTech, we have created a repository of tools, guidelines, and best practices to assist you in your support of refugee and migrants. We hope that this information here can help inform the treatment of those in need. If you click on this blue button right here, you can create an account and you can log in to access all of the learning modules. We have learning modules, module 1 and 2, and then we also have our learning communities in here. Okay. Moving on to the next tab in our website, you will find our resource directory. So let's say we're working in Arizona, and we have every single state in here, including the U.S. territories. And in this list, you'll see service providers from across the U.S. who specialize in behavioral health, medical care, legal services, educational resources, and much, much more. So you can browse through this on your own time, but just a quick overview on, let's say we want to find a certain organization in Arizona. You click on it, and you will find the name, the place, so the address, things like that, the contact information. You will find the website, and if you scroll over to the right side, you will see that there's different categories. It ranges from legal all the way to trafficking. And from here, if any of these organizations provide any of these services, they will have an X on it. Let's say we want to look for a clinic in Arizona. You can search up here and you can find any types of clinics. You can also hit this drop down button and you can customize whatever you're searching for. And of course, all this is free. Okay. And let's say there's an organization that you know that is beneficial to this population. You can please reach out to us, let us know, and we will be glad to add them to this resource list. And then moving on to the last tab that I will be presenting is the consultation and technical assistance request. So right here, you will see that Remtech provides technical assistance through foundational and advanced consultations and guidance for behavioral health care providers and organizations. So these requests help organizations by offering technical assistance to collaborate and improve their organizational goals. Through these requests, Remtech assists professionals and organizations in setting goals, improve staff skills, and understanding to improve services for refugees and migrants. At the bottom of this page, and even at the top of all the pages, you can see that there's this area where you can submit all this information, any questions that you have, or any assistance that you're needing. Just so you know, no PII information will be shared about any of the clients, and we will respond within 1 business day to any of these requests. You can also submit the request by hitting this button, and this button up here is going to be on every single one of these pages. And if I haven't said it enough, just so you know, these services are free. Okay, so now I'll pass it along to the clinicians.
Thank you, Titus, for that wonderful overview. Good afternoon and welcome again, everyone. My name is Dr. Mutsa Majiro. I'm the lead clinical consultant on the Remtech team. I was originally scheduled to present today, but due to being under the weather, I will not subject you all to all my coughs and wheezes. However, you will be hearing and learning from 2 of the clinical consultants on our team, and I will give them a chance to introduce themselves. Thank you.
Thank you, Mutsa, and we all hope that you feel better soon. Just as she was saying, I'm Esther Rodriguez, one of the clinical consultants with Remtech, and I will be presenting a portion of the material today.
Hello again, my name is Luz Chapa, and I'm also one of the clinical consultants for the Remtech team, and it's a pleasure to be here with you today. Great, so now that we have introduced the Remtech clinical consulting team, we will move on to the learning objectives. By the end of today's presentation, we hope you will have a working understanding of the traumatic experiences that affect refugees and migrants and how their stress responses might differ from their US-born counterparts. We will also review adverse childhood experiences, or ACEs, and how they can significantly affect a person's development even into adulthood. But before discussing the principles of trauma-informed approach. So let's continue with our presentation. But before we look into trauma-informed care and its treatment objectives, let's look at the definition of trauma as established by the Substance Abuse and Mental Health Services Administration, known as SAMHSA. Trauma results from an event, a series of events, or a set of circumstances an individual experiences as physical or emotionally harmful or threatening, which may have lasting adverse effects on the individual's functioning as well as their mental, physical, social, emotional, or spiritual well-being. It is important to keep this in mind because understanding trauma and being aware of its impact on refugees and migrants is the basis for the treatment objectives of trauma-informed care. The primary goal here is to establish physical and psychological safety for the client, its staff members, and the organization. When we do this, then providers can support clients through psychoeducation about trauma, common traumatic stress reactions, and treatment to normalize their perceptions of their experiences and understand their resilience in light of their histories of trauma and its subsequent consequences so that they are empowered to address their symptomology. For example, like sleep disturbances and other disorders, to achieve balance through healing. It is also particularly important to utilize culturally responsive services when working with refugees and migrants, because it will result in more effective treatment for traumatic stress, mental health illness, substance use disorders, and co-occurring trauma-related symptoms. This process begins with an awareness of one's own culture and beliefs and includes an understanding of how those beliefs affects one's attitudes towards people of other cultures. It is also rooted in respect, validation, and openness towards someone whose social and cultural background is different from one's own. For example, consider whether the client is a survivor of a cultural trauma like genocide, war, government oppression, torture, terrorism, how to use culture brokers who are authorities within the culture who can help interpret culture patterns and serve as liaisons to those outside the culture. How trauma is viewed by individuals, social cultural support network, and how to differentiate between PTSD, trauma-related symptoms, and other mental health disorders in the culture. This is the basis of trauma-informed care, and as you can see, a very complex process that requires individual and institutional development to provide adequate treatment for clients at all levels. So let's take a closer look at the types of trauma that might define the refugee and migrant experience. As we touched on the previous slide, traumatic events may be experienced by an individual, a generation, or an entire community or culture. The column to the left of the slide lists traumatic events that we are familiar with in our line of work. For example, physical abuse, sexual abuse, emotional abuse, domestic violence, intimate partner violence, and natural disasters. However, I would like to introduce a concept with which we may not be as familiar, which is levels of trauma. Shown on the right side of the slide, I want to differentiate between mass, community, and group trauma, as these might be harder to distinguish than individual and family trauma. Mass traumas or disasters affect large numbers of people, either directly or indirectly. For example, like the earthquake that hit Haiti in January 2010, killing hundreds of thousands of people and leaving over 1 million homeless. Trauma that affects communities and cultures covers a broad range of violence and atrocities that erode the sense of safety within a given community, including neighborhoods, schools, towns, and reservations like hate crimes or gang violence. The term group trauma refers to dramatic experiences that affect a particular group of people. They tend to keep the trauma experiences within the group, feeling that others outside the group will not understand them, and the group outsiders are generally viewed as intruders. Think of the experiences of first responders or military personnel, for example. Now, let's take what we have learned about types of trauma and look at some examples that impact refugees and migrants before they decide to migrate to the US, during their journey here, and once they arrive and attempt to resettle. If we look at the examples on the right side of the slide, we can see human trafficking, which can be experienced as an individual or group trauma that can occur either before, during, or after the migration journey. as well as we see here the lack of resources. This can also occur either in home country, during the migration journey, or after arrival to the US. And unfortunately, oftentimes it does. This can also be individual or family trauma. So to distinguish the levels of trauma, we need to look at the objective and subjective characteristics of trauma. An objective characteristic are those elements of a traumatic event that are tangible or factual. Subjective characteristics include internal processes, such as the personal meaning an individual assigns to the trauma. It is important to remember that what happened is not nearly as important as what the trauma means to the individual. This distinction helps us to determine how to proceed when developing a treatment plan, and really involves clients into the healing process by acknowledging that they are the experts of their own experiences. This also allows the therapist, the clinician, the counselor to tailor interventions that directly address these specific impacts of that trauma, leading to more effective and personalized care, while minimizing the risks of re-traumatization by considering the individual's unique coping mechanisms and triggers. And now I will pass it on to my colleague Esther, where she will review the symptomology that may present itself in refugees and migrants who experience these types of dramatic events. Thank you.
Thank you, Luz. And before I begin, I just want to note that the information on this slide is pulled from the article titled Traumatic Stress Effects on the Brain by J. Douglas Bremer, which will be listed and linked on the resources page for you to access at your leisure. So the findings are summarized on this slide, and they're related to general brain volume, the development of gray and white matter, and the changes in various areas of the brain, like the caudate, the diencephalon, the temporal and frontal cortex, and the hippocampus, at various ages and stages throughout the life. The purpose of this is to show that trauma at different stages in life will presumably have different effects on brain development. The few studies that have looked at this issue do suggest that there are differences in the effects of trauma and neurobiology depending on the stage of development at which the trauma occurs. It's therefore important to keep in mind that trauma will likely present itself differently in individuals of varying ages, so symptomology will be unique. For instance, PTSD presents differently in young children than it does in adults. A child may reenact their traumatic experiences in play with their classmates or siblings. Children may also experience selective mutism or a loss of language after a particularly heinous traumatic experience. While intrusive thoughts and distressing dreams are common symptoms of PTSD at any age, children experience enuresis and encopresis, which is the involuntary or intentional passing of urine or feces in inappropriate places like the bed, more frequently than adolescents and adults. As individuals get older and develop more advanced cognitions and thinking patterns, negative beliefs or expectations about oneself, others, or the world may become more persistent. Adults and adolescents may think that they're bad, that no one can be trusted, or that the world is completely dangerous, whereas young children may not have the cognitive development to have such specific distorted cognitions. Both children and adults may experience an irritable mood. However, younger children may express this as temper tantrums, whereas adolescents and adults may express this as aggression or angry outbursts. This is key to remember when working with families, as providing psychoeducation can help them understand how and why they are each reacting to traumatic experiences differently. Validating individual experiences can help refugees and migrants accept the expression or manifestation of their trauma more readily instead of judging themselves or feeling shame about normal reactions to abnormal situations, which leads us into our next topic, the stress response system. Before we look at the way that the effects of traumatic stress on the brain can impact the stress response system, I want to take a moment to explain how this information was gathered. REMTAC was tasked with completing a literature review to learn what is known about the behavioral health needs of refugee and migrant populations in the U.S. by the grant funder, SAMHSA. Our final report has been reviewed and approved, so please stay tuned for updates on publication and distribution if you're interested in learning more about our findings on the behavioral health needs of refugee and migrant populations in the U.S. Through this literature review, we were able to gather data on the effects of traumatic stress on the internal response system. Amongst refugee and migrant populations, there are high rates of PTSD, depression, anxiety, and substance use, particularly smoking, drinking alcohol, gambling, misusing prescription drugs, and using illicit drugs, typically intravenously. Migrating involves high levels of emotional stress that affect health and that can manifest themselves physically and psychologically. The most common symptomatology was sleep disturbances, namely difficulty falling asleep and staying asleep, which was closely related to mental health conditions. Physical symptoms can also present as headaches, stomach aches and digestive issues, fatigue, dizziness, nausea, palpitations and chest pains, muscle tension, and or jaw clenching. When these physical symptoms are caused by psychological factors, they are considered psychosomatic. In these cases, testing can show that the symptoms are not caused or explained by a medical condition because they are physical manifestations of unprocessed trauma. When this occurs, it's important to provide psychoeducation so clients understand that traumatic stress reactions are normal reactions to abnormal situations, regardless of how they manifest, whether it's physical symptoms, changes in mood, alcohol and or drug use, spiritual confusion, or deterioration of social relationships. Now we'll take a look at adverse child experiences so that we can understand the implications that these traumatic experiences and the resulting stress responses have on the well-being of refugees and migrants throughout the lifespan. So let's review the Adverse Childhood Experiences Study, or ACEs, and the traumatic events that were identified for their long-term effects. First, on the left side of the slide, we see the ACEs pyramid, which represents the conceptual framework for the study. As we can see, the research uncovered how ACEs are strongly related to the development of risk factors for disease and well-being throughout the life course, even resulting in early deaths in some cases. The ACEs study was conducted by Felitti et al. In 1998, and it examined the effects of several categories of childhood adversities on adult health, including physical and emotional abuse, sexual abuse, a substance-dependent parent, an incarcerated mentally ill or suicidal household member, spousal abuse between parents, and divorce or separation that meant one parent was absent during childhood. The National Comorbidity Studies conducted by Green et al. In 2010 examined the prevalence of trauma and defined childhood adversities as parental death, parental divorce or separation, life-threatening illness, or extreme economic hardship, in addition to the childhood experiences included in the original Adverse Childhood Experiences study. If we think of unaccompanied minors or refugee and migrant children, and remember what we learned from Luz earlier in the presentation, we realize that these groups of children experience higher rates of ACEs than their US-born counterparts. Refugee and migrant children have frequent exposure to adverse experience such as escaping conflict or persecution in the home country, escaping war zones, displacement, and living in poor conditions in refugee camps. As the number of ACEs increases, the number of risk outcomes increases. However, early intervention and trauma-informed care improves positive outcomes in those who have experienced ACEs, whether they receive treatment in childhood or adulthood. A trauma-informed care approach recognizes how ACEs affect an individual's health and well-being in addition to their provider's ability to provide treatment in a way that avoids re-traumatization. As a result of this study, it was found that ACEs can negatively affect a person's well-being into adulthood, whether or not these experiences occur simultaneously, are time-limited, or recur. They set the stage for increased vulnerability to physical, mental, and substance use disorders and enhance the risk for repeated trauma exposure across the lifespan. Childhood abuse is highly associated with major depression, suicidal thoughts, PTSD, and dissociative symptoms, which we learned in the previous slide affect refugee and migrant populations at higher rates due to their exposure to traumatic events. So too, ACEs are associated with a greater risk of adult alcohol use, which was also noted in the previous slide as a stress response in refugee and migrant populations as a result of traumatic stress. So now that we've learned about the science of stress, the stress system response, and ACEs, we'll transition into establishing trauma-informed care and the benefits that it can have on the overall well-being of refugees and migrants. Integrating trauma-informed care in behavioral health services provides many benefits, not only for clients, but also for their families and communities, for behavioral health service organizations, and for staff. Trauma-informed services bring to the forefront the belief that trauma can pervasively affect an individual's well-being, including physical and mental health. For behavioral health service providers, trauma-informed practice offers many opportunities. It reinforces the importance of acquiring trauma-specific knowledge and skills to meet the specific needs of clients, recognizing that individuals may be affected by trauma regardless of its acknowledgement, understanding that trauma likely affects many clients who are seeking behavioral health services, and acknowledging that organizations and providers can potentially re-traumatize clients through standard or unexamined policies and practices. Trauma-informed care stresses the importance of addressing the client individually rather than applying general treatment approaches. Refugee and migrant populations oftentimes have the power of choice taken away from them, so it can be incredibly empowering to involve them in their own treatment planning as experts in their own experience and therefore important voices. As we transition into the next part of the presentation, I want to point out that although migration may bring benefits for mental health and well-being among some refugee and migrant groups, others have an increased risk of experiencing mental health conditions. Understanding the challenges facing refugees and migrants is key to ensuring that those at risk of mental health conditions are identified and adequately supported, while understanding the factors that facilitate access to mental health services is essential for effective policy and programming. It's important to keep this in mind as we discuss integrating trauma-informed care into the work with refugees and migrants. Now that we've heard about the benefits of trauma-informed care, we're going to dive into what it looks like to implement it. So when thinking about implementing a trauma-informed approach, people often think that this applies only to clinical staff. However, that's not true. A trauma-informed approach requires all staff, clinical and non-clinical, to recognize the impact that trauma has on an individual and how this plays a role in how they show up in behavioral healthcare settings. This is especially true for refugees and migrants who, as Luz previously noted, have likely encountered traumatic experiences during their migration journey, which could also be exacerbated by stressors that they encounter in the resettlement process. An individual's trauma history can affect how receptive they are to the services that your organization offers. It can affect how they interact with your staff and other clients, and also how sensitive they are to guidelines and interventions. A trauma-informed approach relies on all staff throughout your organization working together to create an environment that is safe and supportive and can result in optimal health outcomes. So when we talk about trauma-informed care, it's important to note that there is not a one-size-fits-all approach to service delivery. Trauma-informed care is rooted in a set of 4 assumptions and 6 key principles, which were established by SAMHSA, the Substance Abuse and Mental Health Services Administration. We will start by talking about the 4 assumptions, often referred to as the 4 R's, and they are realize, recognize, respond, and resist re-traumatization. So what this means is that an organization that is trauma-informed realizes the impact of trauma and promotes a path to healing and recovery. Having a solid grasp of the impact of trauma on individuals, families, and communities enables you to provide a more effective support to refugee and migrant populations, who, as we've noted, often experience high levels of trauma. Realizing the impact of trauma on staff also offers organizations valuable insights into effective strategies to support those who may be at risk of secondary or vicarious trauma. Realizing the impact of trauma puts you in a better position to be able to recognize the signs and symptoms of trauma in patients and their families. This can be achieved through trainings such as the one that you're in right now, and it can help you understand what trauma is and how it presents in different populations, as well as through utilizing culturally sensitive screening and assessment tools. It's important to remember that for many refugees and migrants, exposure to trauma does not end once they arrive in the U.S., and this should be taken into consideration throughout the screening, assessment, and treatment process. Another important aspect of this second R is recognizing the signs and symptoms of trauma in your staff, because working with clients who have experienced trauma puts both clinical and non-clinical staff at risk of experiencing secondary traumatic stress, also known as vicarious trauma, which is a very common and normal response to repeated exposure to the suffering of others. It can manifest as physical fatigue, compassion fatigue, a lack of concentration, avoidance, absenteeism, and physical illness. It can also have a negative impact on the quality of care that staff give to clients and can ultimately lead to low morale and high staff turnover rates. The next R refers to responding, by integrating knowledge about trauma into policies, procedures, and practices. This taps into the culture of your organization as a whole. So think about it in terms of how trauma-informed care starts right at the front door. Your non-clinical staff are often the first to interact with clients and play an important role in setting the tone of your office environment. Consider creating an environment where that initial greeting embodies a welcoming tone. The same can be done throughout your office spaces. So take some time to think about what types of signs do you have up in your waiting rooms and examination rooms? What do your intake and referral processes look like? What do your hiring processes look like? Do some of your staff look like or speak the languages of the populations you serve? Answering some of these questions can assist with expanding your organization's lens of implementing trauma-informed care. And we will talk more about what this can look like in the next slide. Responding by creating policies that allow for ongoing trauma-informed care for your staff and establishing a system of procedures to support staff with trauma histories or who are experiencing vicarious trauma are also important factors to consider in promoting healing and recovery. The fourth R ties all of them together, meaning that we implement the three processes of realizing, recognizing, and responding while actively working to resist re-traumatization. Knowing how policies, interventions, and practices may be triggering to clients and staff is vital to resisting re-traumatization. Resisting re-traumatization in staff entails the recognition of how many individuals in helping professions carry their own trauma histories, which can be intensified by working with clients who have also experienced trauma. Therefore, providing adequate supervision that assesses staff responses to trauma exposure and creates a safe space for staff to address feelings that come up in client interactions are important aspects of support that fosters self-care. In the next slide, Luz will discuss the 6 principles. She will explore examples within treatment that can aid in resisting re-traumatization in refugee and migrant clients.
Thank you, Esther. Highlighted on this next slide are SAMHSA's 6 principles of trauma-informed care. If we look at the first principle, it entails creating an environment that encompasses both physical and psychological safety, all throughout your organization. Promoting a sense of safety can look like the following things: having multilingual signs throughout your welcoming and reception areas, ensuring that clients' rights are displayed in waiting areas and are also explained clearly and offered in various languages. And also making sure that interpersonal interactions with all staff are warm, inviting, and welcoming. An important factor within this principle is viewing the concept of safety through the lens of those who you serve. Anticipating the effects that some environmental stimuli may have on clients. For example, lighting access to exits, and seating arrangements. These are all important factors to consider. Safety also includes creating a pattern of consistency. This involves making sure to follow through on agreed treatment processes, and if any changes occur, to be sure to communicate those with honesty and compassion. Promotion of safety also includes the role of leadership in supporting staff during distressing incidents through formal and informal processes of checking in and providing debriefings. This ties into the principle of trustworthiness and transparency, which relies on fostering trust with your clients through the use of clear communication. Many refugees and migrants are not aware of how the healthcare system works in this country, which can lead to mistrust of the system and services that are available. Taking the time to explain things such as how the information they provide will be used, what confidentiality is, and what the limits are within that, as well as explaining consent forms to ensure clients fully understand what treatment entails. These are key factors to this principle. Ensuring that clients have options in the treatment space and understand what those options are and can help facilitate trust and transparency. The next principle, peer support, is a key vehicle for establishing safety and hope. Refugees and migrants often come from cultures where seeking formal help from professionals, especially related to their mental health, is seen as taboo. Instead, they often turn to community leaders and peers for support. Assisting refugees and migrants with getting connected to peers and community members who are familiar with their culture is a crucial part of promoting their well-being. This can include peer support workers who are individuals with lived trauma experiences who receive special training to be a part of the care team. This can help with building trust, enhancing collaboration, and utilizing client stories and lived experience to promote recovery and healing. The principle collaboration and mutuality places importance on partnering and the leveling of power differences between staff and clients, demonstrating that healing happens in relationships and in the meaningful sharing of power and decision-making. Involving clients in their own treatment planning can be a powerful and empowering experience. And this leads into the principle of empowerment, voice, and choice, which Esther highlighted earlier. Elevating the client's voice by giving them a say in their treatment planning can sometimes be more effective than the traditional approach of the clinicians dictating what should take place. Now, that is not to dismiss our expertise as clinicians. Instead, it helps us to take an approach of cultural humility, which is recognizing that we cannot possibly know all the things about the client's life and experiences, and then determine what is the best for them. Being willing to learn from others in an effort to respect cultural differences, accommodate identities that are significant to the clients we serve, and build on the client's strengths will continue to promote healing and recovery from trauma as well as build resilience. A trauma-informed organization takes on an approach that is human rights and social justice centered, meaning that you are aware of the various systems and conditions that create and uphold abuse, violence, oppression, and discrimination within refugee and migrant communities. This upholds to the sixth principle of cultural, historical, and gender issues. Embodying this principle also means that your organization actively moves past culture stereotypes and biases, offers access to gender-responsive services, leverages the healing value of traditional cultural connections, incorporates policies, protocols, and processes that are responsive to the racial, ethnic, and cultural needs of the individuals served. By adopting the 4 assumptions and 6 principles of trauma-informed care, healthcare systems and providers can help mitigate the effects of trauma and improve health outcomes for refugees and migrants. On this slide, we have provided some links to resources that contain more information about what we have shared today. We highly encourage you to explore them as they will deepen your knowledge of trauma and the topic of trauma-informed care. Now, up next is Diana Romero, our Learning and Development Coordinator, who is going to lead us into a 10-minute meditation exercise.
Good afternoon, everybody. Welcome. So as we all work with a lot of people that have a lot of difficulty in their backgrounds and come from some heavy situations, I think it's important that we as providers take the time to also take care of ourselves so that way we can continue to take care of the people that we work with. So part of that is going to be our meditation exercise. So I'm going to lead you through that in just a moment. I'm going to sit back here. I'm also going to play the crystal bowls as a part of that meditation. You can close your eyes, find something comfortable to sit in, a chair or on the floor, whatever works for you while we're going through this. And according to the National Institute of Health, crystal bowls actually have a very meditative and helpful effect on the body. It can help reduce anxiety and depression symptoms, and it also lowers blood pressure as well. So we're going to integrate that into our presentation today for the next 10 minutes. So I'm just going to sit down and get comfortable while you do the same, and we'll begin in just a moment. Can everybody hear me okay?
Yes, we can.
Okay, perfect. All right, we will begin. So if you are in a comfortable seat, try to find a tall spine. You can gently close your eyes and just begin to bring some awareness to your breath. Breathing in through the nose and out through the nose. Slowly settling here into this moment. Breathing slowly, filling the belly all the way up. And releasing all the way down as you exhale. Beginning to deepen your inhales and your exhales as you release anything that you might have brought here with you today. I like to imagine that I am wearing a backpack, and that backpack is full of all the roles I have to play, right? The roles we get to be a part of. Maybe that's our work roles, our home roles, all the different things that I have in my toolbox. And I like to imagine that as I settle into this space, I take that backpack off for just a moment and allow myself to show up here. Showing up just for you for the next few minutes, allowing yourself to just be here. And as you continue to inhale, we'll bring a little bit of awareness to our breath. We'll begin to find our Ujjayi breath. Our Ujjayi breath is focused on deep inhales through the nose and exhales through the nose. And this breath often sounds like an ocean sound. So you can imagine as you're breathing in and out, a gentle constriction is happening in the back of your throat. And that gentle constriction makes an ocean sound to calm the sound of the crystal bowls. Continuing to breathe with our Ujjayi breath. Adding that ocean sound, gentle constriction into the throat. As you inhale and exhale. On your next inhale, we're going to bring a little bit more awareness to that breath. We're going to introduce box breathing, which is also a really great technique to present to your clients. If they are having some anxiety, it might be something you introduce to them. Your box breathing is a 4-part inhale, 4-part hold, 4-part exhale, and a 4-part hold. So you can join me on the next round, inhaling for a count of 3, 2, 1. Hold. 3, 2, 1. Exhale. 3, 2, 1. Hold. 3, 2, 1. Inhale. 3, 2, 1. Continuing that pattern on your own pace, focusing deeply on the inhales and the exhales as you listen to the sounds of the bowl. Keeping a tall spine, settling in with your breath. beginning to deepen your inhales and your exhales as you bring your awareness back to the present moment. Breathing deeply in through the nose, breathing deeply out through the nose. Feeling your energy begin to expand as you wake from this restorative sound bath. And when you're ready, you can gently float your eyes open, imagining that your backpack, you've picked it back up and put it back on, so you can resume your roles and your duties, but with a little more peace and grace as you encounter others, your loved ones, and yourself. Thank you. Thank you so much for that, for attending. We do very many other programs here. So I am the Learning and Development Coordinator. We do learning communities, which are intimate groups where we work on addressing some challenges that are happening within our communities. We also have learning modules as well, and our consultation requests are another area that we can support you. So we're happy to do that, and I'm grateful that you shared space with me today.
Thank you so much, Diana. For those of you that are still on the call, we just ask if you could take a few minutes to scan the QR code or use the link that we will drop in the chat to complete our survey and provide feedback on the webinar. And we'll make sure that these resources are available to y'all.